So I think when we think of trying to preserve sensation at the time of mastectomy, the goal is really two-pronged. So part of it is actually to keep any of the nerves that run right under the skin in the fat layer there. The key is they have to be in that fat layer and not in the breast tissue, or else it's not a safe mastectomy. So one, keep nerves that can be saved from an oncologic standpoint. And then the second is to reconstruct the nerves that go through the breast tissue. So those need to be cut to do your mastectomy well, and then we can reconstruct them during the same surgery. So the idea is with preservation and reconstruction, we can get really good sensory outcomes. I get asked a lot about if sensation-preserving mastectomies are safe from a cancer standpoint, and what I always tell people is we will never sacrifice or compromise your oncologic outcomes for the sake of nerve preservation. We know that cancer is first and foremost most important. So if the nerves are able to be saved, wonderful, but we really feel like we do your mastectomy first and foremost the best we can, and then we'll reconstruct nerves to help get that great sensation, and we can still do a really good mastectomy. So we don't see any increased risk of cancer with these procedures. So when we think about why people have chronic pain and nerve injuries after mastectomies, what's happening is you're forming these balls of scar called neuroma at the site of cut or injured nerves. So what's really cool in plastic surgery is we know if you give nerves something to do, so you reconstruct them, you avoid just cutting through them and burning the nerve ends. Actually, people aren't going to have long-term chronic pain. They're not going to have something called dysesthesias, which is kind of too much sensitivity. So we're really careful in how we handle the nerves, reconstructing them, and making sure we preserve the ones that we can without injuring them and causing big balls of scar. So one of the things I hear a lot about neurotization is that people aren't always sure how well it works. And I think a lot of that is because a lot of people aren't actually studying it in a formal way. We need to learn a lot more about which people are great candidates. Is it based on how big your breasts are, or what kind of other treatments you need, nipple sparing, non-nipple sparing. So I'm really excited to see that more practices are actually taking this on as a research study. We're seeing more data being presented across the world, actually. And so I think the more studies we have looking at outcomes in a wider variation of patients, we'll be able to know more about how well it works.